the relaxation of the rules. Others are worried we're lifting lockdown a little too early. Joining us to discuss this is Johnn Apter, Chair of the Police Federation of England and Wales. We also have retired pathologist Dr. John Lee and psychologist Professor Susan Mickey. Good to see you all this morning. Thank you very much for joining us. John, if we can start with you, Johnn Apter, the Chair of the Police Federation. How concerned are you for the police force around the country? This lifting of restrictions and trying to understand what we can and can't do is one thing. But the police have been in an unenviable position all the way through, trying to police what we can and can't do anyway. And I'd imagine this is just going to complicate things further.
Yeah, morning, Ben. It has been really difficult. And what we found last year when we started to ease out of lockdown before is people, understandably, I don't criticise them, but people saw that as a free-for-all. So we saw more people gathering than was allowed in law. There was a real confusion over what was guidance and what was legislation. Guidance is not legally enforceable, and we've still got elements of that now. There's obviously differences with the Welsh government and the Scottish government, as well as England, so there's differences there. So there is some confusion, and there will be, and we're used to that. But the problem is my colleagues get the brunt of that frustration out on the street, where they're just trying to do the very best they can.
We saw the situation, didn't we, where there were two women who went for a walk. It was considered that, because they had a coffee, that was a breach of the guidance, and the police got into trouble for fining people who went to the beach or who travelled too far. Now we have the end of stay at home. You are allowed to travel, but the guidance is that you should minimise travel. So does that mean that police will stop people on the motorway and say, is this a well, they can't say, is this a necessary journey, but will they say, have you minimised travel this week? I can't see how that is a useful rule now.
No, it's not a rule, Susanna, it's guidance. And as I said, guidance is not legally enforceable. As a member of the public, we've got a moral duty to our fellow citizens, but it's not legally enforceable. It's the same with social distancing. In some parts of the country, in the devolved governments, there's some element of law around social distancing, but in England, it's not. I think people expect the police to enforce social distancing, but it's not legally enforceable.
That's so interesting. So when the government says you can now meet rule of 6 and you can meet outdoors, actually legally there is no restriction on the distance you can travel or the number of journeys you can make. That is simply covered by minimised travel. That is guidance and will not be enforced by the police.
Absolutely, yes.
OK, and just another issue with the police, Johnn Apter, is that protest is now allowed, as I understand it, under these rules. The police have had a particularly difficult situation, haven't they, when they've had to enforce social distancing and gatherings and numbers of gatherings under the coronavirus legislation. Does this make it slightly easier?
It doesn't. There's still an awful lot of confusion over whether people can lawfully protest. And the difficulty, even when they couldn't, because of the number of people attending, because it then breaches the number of people allowed to gather, then we've been asked, well, why don't you just arrest everybody or give everybody a ticket who turns up? That's just not practical. You get 1,000, 2,000 people turn up. If we were going to start enforcing at that level, then that would make things turn out even nastier than we've seen, and it's been bad enough as it is. So my colleagues are telling me, and there's a lot of concern as we ease out of lockdown, that no matter what they do, there'll never be enough for some, and it'll be too much for us. We really are.
Let's talk to Dr. John Lee, because, of course, we are easing out of lockdown, Dr. John Lee, and there are concerns from some. I mean, Johnn Apter's saying there's some concerns from some that the police aren't doing enough for some and they're doing too much for others. Equally, there are concerns by many that we are lifting lockdown too soon, and for many others, it's been too long that we've been restricted. What's your take on this? Do you think the government has done enough? Is this the right time for us to be sort of releasing the lockdown and lifting some of these controls?
Good morning. Yes, well, I mean, I think the issue here is, as it has been throughout the last year, is what is a proportionate response to the threat we've been facing. And what the last year really seems to have shown, as far as I can understand it, is the dysfunctionality of the way that the government gets its advice from its scientific advisors. they've been working on the precautionary principle, the better safe than sorry principle. And what it's meant is that we've taken really hugely draconian steps to deal with a threat which could have been dealt with, in my opinion, and in many other people's opinion, with a much gentler, softer approach. I mean, you've really got to question the level of threat that's necessary for the government to tell you who you can hug at Christmas. So yes, I do think it's right to ease the lockdown now. I think the vaccination programme, fortunately, has been a great success. The number of people who are currently dying of COVID, of people who are dying, which is about 1,600 people a day, less than 1 in 80 people are actually dying of COVID at the moment. And that's despite throwing everything and the kitchen sink at trying to identify every single virus that's around in hospital.
So do you have do you have few concerns that with the lifting of the lockdown restrictions that people are going to get together? They might be inclined to want to hug because they haven't seen each other for a long time, even though we're being encouraged to keep the 2 metre distance. They might be inclined to go into people's houses because you can meet in the garden, and then maybe if you've had a few drinks and you're enjoying each other's company, it gets cold outside, you want to go. Does that concern you that that might happen? Are you thinking, do you know what, we just need to deal with these things and now's the right time?
I think it's long overdue that people were doing those things, to be honest with you. I mean, a lot of the assumptions, a lot of the what people have come to regard as clear scientific consensus over the last year is nothing of the sort. The clear scientific consensus has been because dissenting voices and people with different views have just simply not been heard. And that's why at heartgroup.org, that's the Health Advisory and Recovery Team, a group of over 40 professionals from different walks of life, we've just recently published a large booklet summarising in detail the evidence for many of the things we've been told to do. So asymptomatic spread, for example, which has been one of the key drivers of government policy, has very little supporting scientific evidence, and you can read it all for yourself in our booklet.
Okay.
So yes, I think it's overdue.
Professor Susan Mickey, I can imagine you take a very different view to Dr. Johnn Lee. I mean, Dr. Johnn Lee says that those voices aren't being heard. I think they are being heard in some sections of the media and on social media, that this has been too much and some of the risks have been overplayed. The fact of the matter is we've had 126,000 deaths, and we know from the evidence that lockdown does work. You know, when you introduce lockdown, you reduce the spread and you reduce the deaths. The problem is today, a couple of weeks after we had schools going back, we now have another big lifting of restrictions. Dr. Johnn Lee says that can't come soon enough, but I wonder about your concerns about what this will do for transmission.
Good morning. I think we're in a very difficult situation because I absolutely agree that having 6 people or 2 households of however many outside in itself is absolutely fine. We know that transmission is much lower outdoors. Something like 19 out of 20 cases of transmission happen indoors. So long as people stick to the rules in terms of meeting outdoors, then we should be fine. But as you say, the problem is people going into each other's houses. And once that happens, and especially if there's not good ventilation, especially if people are touching surfaces without having sanitized their hands, then we have a great new transmission route for the virus. And I think we need to look at actually what the real situation is. We're still having several thousand new cases a day. And unfortunately, for the last 2 weeks, what was a declining rate was coming down week on week, has stalled. And in fact, in Scotland, is beginning to go up. So this is quite a dangerous situation when we still have quite a high rate of transmission, which means many mutations are happening, because every time the virus goes from one person to another, there's a chance of mutation. The more mutations, the more new variants. And the more new variants, the greater the chance that our wonderful vaccination programme is undermined.
Okay, Professor.
And we know we already have the Brazil and South African variant in the community in the UK.
Yeah. Can we, at this stage, when schools opened on March the 8th, can we trace any consequences of that yet? Because, of course, the government says it's going to go by data, not by dates. It's going to measure the impact of each loosening of the lockdown. What has been the impact of schools opening?
Well, I think the assumption is the fact that Scotland's transmission rates are beginning to go up reflects schools having opened a couple of weeks earlier. And the Scientific Advisory Group on Emergencies has also warned that, and it's not surprising, that when you open up schools, which means that many people are in enclosed spaces for many hours every day, that the transmission will go up more. So then the question is, given there's a consensus, we want children to be at school, it's good for them, they need to be at school. We need to say, well, how are we going to balance that if we're going to stop the R going above 1 and getting exponential growths again? Now, there are several ways in which that could be done. One is that we know that there's a considerable percentage of people who could work at home but are currently not working at home because of employer pressure or being worried about their jobs. But we're getting mixed messages here. On the one hand, we are meant to be working at home where possible. On the other hand, we have our Prime Minister suggesting we shouldn't be.
Yeah. All right. OK. Sorry to interrupt, but just running out of time. Johnn Apter, just finally, with the lockdown easing, groups can meet, 2 households can meet together, perhaps in the park. What are police going to do in a situation where they see, I don't know, 10, 15 people meeting? Do they now approach that group and say, hang on a moment, there's a rule of 6, can you prove you're from 2 different households and are allowed? Or are they going to be hands off at this stage and think, actually, we're just going to step back?
They'll be doing what they've been doing throughout this whole crisis, Susanna. They'll be engaging with people, and if there's complaints, because we're still getting complaints from members of the public who are genuinely concerned that the actions of certain members of the public are causing this virus to spread. So they'll do what they've been doing, but it's incredibly difficult, as you can imagine.
Yeah. All right. Well, good luck to all of you. Thanks very much indeed.
It is 20 minutes to 8. Still to come this morning as George Floyd's murder trial begins today.